And welcome back to Senior World Radio. I'm Glenn Howard, your host this morning with Bob and Rod Cleveland and a very special guest, orthopedic surgeon Dr. Kirkpatrick. Doctor, thanks so much for coming in today. Just before we went on break, though, we were talking a little bit about hip and knee replacements and all that goes on, and particularly the pain involved with it. Do things like AMR-7 and various ways of reducing pain provide an assistance in trying to help prevent those kind of things?
Well, I want to be very clear that we don't have a cure for arthritis, either with this product or with any of the treatments I provide through my clinic. And in fact, even a knee and hip replacement is not a cure for arthritis. It's simply a way of treating or shielding that bone from the stress that it's seen from that loss of articular cartilage. But what really matters is what's happening around that joint and what's happening with the muscles around that joint. And the lining of everybody's joint is aligned with what we call synovium, and that synovium is very sensitive and irritable. And so if you can provide some relief for that tissue, that soft tissue, and the muscles around the joint and the capsule, oftentimes those patients get quite a bit of relief from their arthritic type symptoms, that to the point where they're happy or satisfied with that, and that their threshold for surgery is lowered, where they don't want to have a surgery because they're doing okay without having to have that. I tell patients in clinic all the time, if we can provide non-operative relief from arthritis, regardless of how bad their x-rays look, as long as they're comfortable and happy and living their lives without too much symptoms, that's what we should do to try to avoid surgery.
You know, Doctor, we talked earlier about Sheriff Lester was having experiencing some knee problems, and he's having wearing brace on both knees. And he was saying that, tell me how bad he was hurting. So I got him to use some AMR-7, and it helped him out. He quit wearing his braces. But recently he had to have a surgery on one of his knees. I think the doctor was one of your associates, Dr. Bond, had done his knee surgery. But I noticed I went and Googled arnica in New York Times. In the New York Times, they got some scientists. They took 40 people who had knee trouble, and they all had pretty much identical the same problem. They took 20 of them. They gave them arnica for 30 days to rub on their knees for pain, and 20 of them they gave Tylenol for 30 days. And the ones taking Tylenol, 18 out of 20 had pain relief. The ones using arnica all 20 of them had pain relief at the end of 30 days. So what do you think about that when learning what arnica does and everything about arnica?
When you think of a study, if there's a topical medication or product that would provide the same or equivalent relief as a medication that you'd take by mouth with a known side effect profile, although we use Tylenol in society fairly ubiquitously, I would challenge that the vast majority of households have a bottle of Tylenol in their shelf. It's certainly not an innocuous medicine. There's risks associated with that, especially with the liver. Most of our pain medications have a Tylenol carrier, and the dosing of those narcotic pain medications are related to the Tylenol, not to the narcotic. So that's how serious that medication can potentially be. So if you could provide relief with a topical as opposed to an oral medication, I think you'd find that doctors almost in complete agreement would decide that was a better thing than taking a medication by mouth.
So anytime you can take something externally rather than internally, you're a lot better off doing it.
Yeah, I mean, there's certainly exceptions. I wouldn't rub gasoline on my legs, but right. In general, as long as those products have been used and found to be safe, as well as far as skin irritation, all those things, which AMR-7 has been, I absolutely would agree with that.
Rod, we've been talking about AMR-7, but where in the world can people get this wonderful product?
Well, the first place you can get it is from us, Performance Health. You can call our office in Norman at 405-360-5733 or statewide at 800-321-7774 and mention your name, Glenn, and you'll get $5 off of your first purchase.
That's a good deal.
So that'll help out. Also, we are in a number of metro area and statewide pharmacies, and whenever we meet with these pharmacists, we meet with them, we talk to them. That's one thing that they like our product because it sells and it resells. That's something that they found that makes them excited whenever we go talk to them, and they hear the feedback from customers. One of the pharmacists that I talked to, he said that he came in and one of his clients was using another product that has emu in it and has a name called Blue, and he first thing that he noticed was that the amount that it takes of AMR-7 whenever they apply it to their painful area compared to the other products that they've used in the past, and that the non-greasy feel to it and the quick effective relief that they receive from it from just a small amount, they really thought the value of the product was tremendous.
Bob, I think I've seen some of this also in some of the Homeland pharmacies, haven't I?
A Homeland pharmacy there in Norman on Robinson Street has AMR-7. We got a number of pharmacies around, like at Nichols Hills Pharmacy. That's an old-time pharmacy. They still even have the counter when you go in there. It's like going back in time. They have the counter there serving food.
You begin to reminisce about the good old days.
That's right. And you go back to the days when I grew up in the Capitol Hill area and went to Capitol Hill High School. But you got out in Yukon, you got Miller Pharmacy. In Dale City, you got Lassiter Pharmacy. Edmond TV Discount Pharmacy. Dr. Doan over there on northwest part of Oklahoma City, he carries it in his family practice. Sooner Pharmacy carries it, and Ken's Pharmacy. Just to name a few. We have them all over. In Durant, you got Corner Drug. But one of the pharmacies that we have, Sooner Pharmacy, this guy, he sold 72 jars in one day of AMR-7. He told me that since he's been in business for almost 35 years, he's never sold 72 of anything in one day. And he just couldn't believe it. And what happens? You know how that happens? Word of mouth. People buy it. They tell somebody else. And he said the people were coming in there and they were buying 3 or 4 jars. They were sending it to this cousin, that cousin, aunt and uncle, what have you. And they told somebody else. So it's people try it and they say this stuff really works.
Rod, I think you also have a good website where people can get this, do they not?
Yeah, so you can get it on the web at getamr7.com. And then also at arthritisandmusclerelief.com. That has a little more information. It's our blog site that has some other articles about just healthy living and other elements that if you want to get some other information on and some other links.
So that's GETAMR7.com.
That's correct. The number 7 at the end, yes.
Doctor, let's go back to you for just a moment. I'm really interested. AMR-7, they talk about arthritis and muscle pain. I've heard Bob say something about it also helps with bruising, everything else. Are there any downsides to a product like this? It sounds to me like this is something that can pretty well be used any place you hurt.
Yeah, I haven't seen any or am aware of any type of downsides to it. I certainly probably wouldn't taste very good if you ate it. I don't know. It might go good on crackers. I don't know. But I certainly don't see a downside to it. I don't see there's a way that you're going to overdose on this type of product. And you can apply it to pretty much anything. I would probably steer clear of putting it on open wounds for sure. But as long as your skin's intact, I don't see a downside really to it at all. No.
And, of course, the nice thing about it is that the smell is not that strong, and it doesn't leave that greasy feeling, or at least I didn't experience that, Rod.
No, it was. It's been formulated so that it immediately penetrates deep into the skin. The other thing, too, that what we try to strive for is, I've used analgesics. I've used the Theragesics, the capsaicins, and I've used that in the past. And I've talked to people that they don't really like that. Some people want that heat feel, but that's all they're getting is just a heat feel. They're not getting actual relief. It's just kind of I guess it's kind of taking the nerve endings and confusing them a little bit, and that also can irritate the skin. And with AMR-7, with the menthol, that's what we use the menthol for, is an anti-irritant, and it kind of gives them a smooth, cool feel onto the skin, and then arnica penetrates deep for the relief.
Bob, I want to tell you, I think you have really hit a home run with this product, because when you can have an orthopedic surgeon who will take time to come out and say, I recommend to my patients they use it. This is the stuff that really works. And then you've got the local county sheriff that has had very good success with it, and he recommends it. and you've got your local pharmacist that says this stuff is great, and you've got the chiropractors, everybody that uses it likes AMR-7. This is a great product, and well, I'm just so glad you guys have come in to talk to us about it today, because this is the product that really works. Let me encourage you once again, look on the website, getamr7.com. That's getamr7.com. I'm Glenn Howard with Bob and Rod Cleveland, the people who make this wonderful product, AMR-7, and also Dr. Kirkpatrick, who has come in to be with us, an orthopedic surgeon. Doctor, thanks so much for coming in today. It's been so good to have you, and I hope everyone will get a chance to try for yourself. You'll find AMR-7 is the stuff that works. We've got to take another one of those breaks, but don't go away. We're going to be coming right back. Thanks so much now. See you later.
News Radio 1000 KTOK and KXXY 96.1-2, Oklahoma City's news, traffic, and weather authority.